Hello, I'm Kim Buckman, Director of Support Coordination for County Connections. This is Module 4 of the Employment First Toolkit. This module is about motivation to work. Throughout this module, you will learn strategies which can be used to guide meaningful conversations that can impact positive change. Please keep in mind that employment is change. It is change to those who have never worked. It is change to those who have grown up in a culture where employment was not common, and it's change for those who have only held one job for a long time. For many, employment is a new pathway. Throughout this module, you will learn strategies to help identify and overcome resistance to change and barriers to employment. A common strategy to approach change and develop meaningful conversations is motivational interviewing. Motivational interviewing is traditionally a therapeutic model, but it has been adopted by a variety of professions in a variety of situations to motivate change or promote different pathways. Motivational interviewing is a conversational approach that is person-centered. It avoids confrontation around resistance and ambivalence to change and prompts individuals to contemplate the idea of change. This approach strengthens an individual's motivation to commit to change or to a new pathway because the motivation is internal versus someone telling them what to do. The first step to eliciting change is to build a strong rapport. A strong rapport helps support coordinators lead conversations and helps support coordinators learn more about an individual's vision and trajectory towards that vision. To build a strong rapport, start with finding similarities and emphasizing those commonalities. Mirror your body language and posture when talking with the individual and show an understanding of the individual's beliefs, history, life experiences, and current situation without any judgment. Stay positive and show a genuine interest in the individual. The stronger your rapport, the more likely you are to be able to elicit change. Once rapport has been established, strategies of motivational interviewing can be implemented. These strategies include open-ended questions, affirmations, reflective listening, and summarizing. Remember that motivational interviewing is a conversational approach. When conversing with the individual, ask open-ended questions to learn more about the individual's life experiences, values, behaviors, and vision. Affirmations will show support and continue to build rapport. Affirmations encourage the individual's confidence in their motivation to change or try a new pathway. Convey your understanding back to the individual to reflect that you're listening and understand what they are communicating. And lastly, summarize what has been discussed to ensure everyone has the same understanding of the individual's vision and trajectory towards that vision. This technique of motivational interviewing is most effective when it's used early and often and should be adapted appropriately based on the individual's needs. The role of the support coordinator is not to tell people what to do, but rather help them find out for themselves why they may or may not want to do something. The key principles of motivational interviewing can be applied to do this. Start by developing discrepancies. Help people identify and make sense of discrepancies between what they want and what their choices reflect. For example, if a mom says she doesn't want her son to sit at home all day without anything to do, but she also doesn't want him to work, that's a discrepancy that you can help them work through. Express empathy and an understanding of the individual's concerns or resistance to change. Amplify ambivalence. Help people explore reasons to change compared to reasons not to. Many times people have conflicting feelings about change. It's important to help individuals recognize and work through that. Avoid confrontation and roll with resistance. Remember, it is not our role to judge or tell people what to do. If an individual feels attacked or criticized, they will be less likely to make change happen. And support self-efficacy. There is no right way to change. Support coordinators may need to be creative with problem solving to help people believe that employment is possible. There are two things that primarily hinder change: resistance, which is the act of opposing or struggling with change, and ambivalence, which is having contradictory ideas about change. These hindrances can be internal or external. As a support coordinator, it's important to understand our role and the roles of others in creating or exacerbating these roadblocks to employment. Employment First advocates for the individual's need for gainful employment, even when that means getting the individual on board with the life changes they will have to make and barriers they will need to overcome. Barriers to employment can negatively impact the individual's perception of their abilities and of their outlook on employment. Individuals may present with ambivalence towards working and resistance. Resistance is typically based on one of these concepts: complacency, which is when the individual has developed a certain comfort level with how things are. Resignation, which is an assumption that employment won't work, so they become resigned to the fact that they should not pursue that type of change. Or cynicism, whether based on their own previous experiences or that of others they've seen, they expect it to fail. And fear of failure or fear of the unknown most often drives resistance. Support coordinators must work to understand the individual's fears and understand why the individual is resistant to change. There are 6 stages of change, and it's important to recognize and understand the stage of change an individual is in. Pre-contemplation is when people have no intention to take action. They are often unaware that their behavior is problematic or produces negative consequences. Contemplation is the stage when people intend to start positive behaviors soon. They recognize that their behavior may be a problem and are more thoughtful and practical when considering change. Preparation is when people are ready to take action. They start to take small steps towards that change and believe that changing will lead to a better life. Action is when people have recently changed their behavior and intend to keep moving forward with that change. Maintenance is when people have sustained that change and intend to continue to maintain it going forward. They work to prevent relapse into earlier stages. And relapse will happen. People typically think of this in terms of addiction or substance abuse, but relapse is simply falling back into old patterns. For example, an individual who wants to work but doesn't take care of their hygiene and puts their employment at risk could cause an individual to relapse. Once you recognize and understand the stage of change an individual is in, the best way to support them is to meet them where they are. When an individual is in the pre-contemplation stage, the support coordinator should show empathy. In the stage of contemplation, the support coordinator should help the individual explore the idea of change. When they reach the preparation stage, the support coordinator helps the individual clarify their plan and set goals to put their trajectory on track to reach employment. During the action and maintenance stages, the support coordinator is working with the individual to put their goals into action, monitor the plan, and set new goals as needed. And when someone falls back into a previous choice, it is the role of the support coordinator to help them regroup. It is important to note that individuals must choose to change and commit to that change of their own accord. Support coordinators facilitate the process, but do not make the decisions for individuals. And know that change is not a quick process. For some, it's a lifelong process. As support coordinators, 3 of the most important stages of change are preparation, action, and maintenance. This is where you play a larger role of helping the individual plan, set goals, and work with the individual to prevent relapse into old choices that throw their trajectory off target. This is when person-centered planning tools such as charting the life course could be utilized to help facilitate these conversations. And as you work with an individual to set goals, ensure they are SMART goals. Ensure that they state specifically what the individual will do, that there's a way to evaluate progress, that the goal is something that is relevant and achievable for the individual, and make sure that the goal is time-bound. SMART goals will help the individual achieve and maintain the change they have chosen. For more information, you can Check out these references and resources.